Welcome to Face to Face for the Newsfirst team. I'm Niresh Eliathambi. Well, over the last several years, almost every family in Sri Lanka underwent a tremendous financial transformation. Millions of people fell below the poverty line. And of course, the government of the day, that's the last government, responded with a new welfare program, Aswasuma, which replaced the earlier one, which was which had replaced the earlier one, which was Janasavya. So we've had lots of welfare programs over the decades. Now, what we need to find out, what every government needs to know, is how effective are these programs. It's not simply a matter of handing over money to families and hoping that they'll pull themselves out of poverty. It is identification of the situation in which each family is in, and then identifying their needs, and after they are given the welfare benefits, whether in cash or something else, to identify whether it's effective, and if it's not effective or not effective enough, what more can be done, and to collate all this information into scientific data, which is something that we can all understand and is usable to the policymakers. It's only in this way that governments can understand what's going on with their people. Now, to discuss the importance of this scientific research, we have with us this evening Dr. Pulasthi Amarasinghe, Research Fellow at the Institute of Policy Studies. Good evening and welcome, Dr. Pulasthi.
Good evening. Yes.
Right, to give a little bit of an introduction, Dr. Pulasthi is, of course, an economist who is involved in deep research into societal matters. He holds a PhD in economics from the University of North Carolina at Chapel Hill in the United States. He last week published a research paper through IPS, or I should say IPS published his research paper on the impact of the Aswasuma program so far. So, of course, every program is a work in progress, so it is important to know the impact so that these programs can be improved. Now, Dr. Pulasthi, can you talk to us about the importance of your research and how you go about collecting all this data and the manner in which it can all be used?
So thank you for giving me this opportunity to talk about something very important right now, especially in the current context. So as you know, back in 2022, following the economic crisis, the poverty levels were shot up to 25% in Sri Lanka, putting millions of Sri Lankans at risk.
That's probably over 5 million people, 25%.
Yeah, exactly, right. So at that time, the government came up with a different approach to social protection. I mean, of course, it needed revamping at that time as well, to a more transparent and a well-targeted system. Of course, Aswasuma was introduced as a work in progress or a temporary measure to move from the then existing Samurdhi program towards something that uses this social registry, or to provide cash transfers and other relief to households. And in my research, what I believe is that we need to figure out whether these transfers, whether the targeting is happening at the way we want, or the way we expect, in terms of transparent, well-targeted system, right? So what I do is I use the existing data, especially from the DCS, the Department of Census and Statistics, the existing household income expenditure surveys, to conduct a data exercise. So following, the regulations, the eligibility criteria. So Aswasuma, let me talk a little bit about how Aswasuma is provided, and a little bit about the social registry, because I think that would help in terms of understanding the process behind it. So
Absolutely.
So the eligibility for this program, or the social registry, hinges on 6 dimensions of the household. These are the assets, education, housing, income, health, and the economic level. So there are 22 indicators across these dimensions, and how the eligibility is simply based on how deprived a household is across these 22 indicators, and there's a weighted score for each household.
So it's fairly comprehensive.
It is fairly comprehensive, and it covers, 6. In these 6 categories, it covers many things. For example, for assets, it covers land ownership of other sorts of assets, like vehicles. When it comes to health, it looks at the number of individuals with disabilities. Education, it looks at number of children not going to school. So it is quite comprehensive in the areas it covers. So 22 is a lot as well in terms of an index. And what it does is, once households are given this deprivation score at the district level, they are determined if they are severely poor, vulnerable, or transitional according to the deprivation score, and they are given these cash transfers. So what I do in my paper is a data exercise looking at the effectiveness of this existing 22 criteria in capturing the neediest households, and I simulate these transfers through an economic model to see the possible impacts on key welfare outcomes, namely food insecurity, indebtedness, and labor force participation. I'll talk a little bit more about why I chose those, because these are in line with what's done in economic literature. But following this, I also test some alternate methods to approach the selection apart from the existing 22 criteria, because that's been a hotly debated topic. Whether this coverage and expansion, or the targeting is done correctly under the program, and this is what I do. It is definitely of significance to the current policymakers, especially at a stage where they are trying to determine if they do need to make changes to the existing 22 criteria.
Now, the objective, of course, the government's and everybody's objective has to be to reduce the number of people or families below the poverty line. So from 25%, we want to head towards as close to zero as possible. Zero, of course, is rather difficult to attain, but 25% is way too high. So the issue, I think, is, would the Aswasuma program or any other program, would it actually bring this poverty level down? Because of course you don't want a quarter of your population permanently on welfare. Of course, certain segments like the elderly, differently abled, and so on might need help, but you don't want able-bodied people and their families below the poverty line, for decades. So this is vitally important to figure out what are we doing right and what are we doing wrong.
So yeah, definitely. So of course, like you said, 25% to zero is not an easy task. It's almost impossible at the current stage, given we are still recovering from a huge economic crisis, but we do have to look at the progress made before the economic crisis. The poverty levels were down around 3 12 or 13 in that range, 12 to 13%, and the jumped up to 25% in 2022, and it has stayed in that range. So in 2023 it stayed around 25 to 26, and then now it has come slightly down to 24%. But I think still World Bank last year has mentioned that 1/3 of the population faces the risk of falling back into poverty. I think there was a recent study by the UNDP looking at this idea of a multidimensional vulnerabilities index, similar to Aswasuma, where they create this vulnerability index across these 12 or key indicators looking at education, living standards, health, and disaster capabilities or disaster capacities. And what they found was around 55.7% of the population is vulnerable to these multidimensional vulnerabilities. So that is a huge number. And of course, there's no easy prescription to get out of this. And what we do have to consider is that not everyone in that 25% have the same difficulties. So in economics, what we have is something called chronic poverty and transient poverty. Chronic poverty is more structural. So cash transfer is unlikely to bring someone without, for example, proper roof, proper house to out of their condition, especially cash transfers quoted by Aswasuma. So they need bigger structural changes, bigger changes in the economy, to bring them out of the condition of chronic poverty. But transient poverty is a different condition. These are shocks that bring people up just below, or people who are just above the poverty line back down. So they have a probability, or they have a possibility of escaping these conditions. Moving out of poverty is possible through cash transfers to these households. So the question then comes to whether we are targeting them in Aswasuma or in any sort of social protection or social registry. Are the existing criteria, are they enough to target them? Because we need to make sure the prescription is correct. So if we are focusing on cash transfers, I'm not saying that transient poverty should be replacing chronic poverty, but we should be capturing transient poverty on top of chronic poverty.
Right. But just to clarify, are there any numbers on out of the 25% or the 24%, as you said, how much of that would be chronic poverty and how much would be transient?
So these numbers, 25%, so these were done based on projections. I think the World Bank has conducted several projections using previous data. And what they did was, so this was mainly done at their 3.65 per capita, per day, dollars per day, number of individuals above that and below that. So this is a different way of looking at poverty. This is different from the multidimensional vulnerabilities, where this idea of chronic poverty and transient poverty is more applicable. So the idea there is, there are certain conditions or certain criteria that are more suitable for chronic poverty, or there are certain ones that are more suitable for transient poverty. For example, electricity could be an effect of transient poverty, where households directly respond to what's happening in the economy through reduction in the expenditures when it comes to electricity consumption. Income loss, employment conditions, these are immediate effects that could put households back into a very vulnerable state. So these are present in the 22 indicators, and they are given a certain weight based on how common they are in the society. But right now, I don't think there is a clear way to say a certain percentage is chronic poor and certain percentage is transient poor. But that is definitely a distinction that we do need to make when we are offering these prescriptions. Right.
Now, what are the key predictions or the key findings of your research on the welfare effects of Aswasuma. How has it panned out? What was the impact?
So in our study, we looked at 4 key welfare predictors. So one being food insecurity experience. So this basically entails any case where households said that they reduced food consumption or they reduced the quality of the food they consume. This is more of an immediate shock when it comes to responding to any sort of economic impacts. So basically,
right. And this is very crucial because it impacts children.
Yes.
You have malnourished children, their growth is retarded or even stunted, and that is not something that any person would want for a child, because you can't put off feeding a child. You can't say, okay, the next 2 months we'll have to have 2 meals a day, and then when things are better we'll go back to 3 meals. I mean, you could do that with adults, but you certainly can't do that with children because they are growing.
Yeah.
So this is a very, very crucial indicator.
Yeah. So another thing on that is, usually what happens is, when households employ these coping mechanisms when it comes to dealing with increased food prices. For example, I think in 2023 the Department of Census and Statistics did this economic crisis impact survey, and they found that 99.1% of households reported that they face increased expenditures from food prices, which is of course the case because there were large increases in food prices. So in terms of coping mechanisms, what they do is, households prioritize children in terms of quality food. If they are not able to get quality food, they prioritize the quantity, which is, the first order priority for them in terms of getting the energy intake. Right. So, and this opens another can of worms because, the energy intake, while it is an immediate concern, nutritional security is another concern. So 90% of the country's disease burden is coming from NCDs. So while it is important that we are, looking after children, the other side with the health costs, the health burden to the communities, to the individuals, households, and the country itself is only going to rise if we are not addressing these nutritional, concerns with the nutritional security along with food security. So yes, so this is a very immediate impact that we are likely to see in a few years, probably when people's health deteriorates due to poor dietary habits. But we have already seen these effects, especially in children in the past few years. We have seen malnutrition numbers go up. I think the Family Health Bureau, they do this nutrition monthly where they cover 99% of the primary school children in terms of collecting data on them, and you can see these localized effects, but overall you do see across the country an increase in malnutrition, and effects are likely to show up a little bit later in the next few years. But yeah, so this is a very key indicator that I want to look at. The other side I study is the level of indebtedness. And it is also, it could be both short term but also a long term shock, and then the other two being the labor force participation. The reason why I picked these is usually in other countries and other contexts, when there are cash transfers, it's likely that labor force participation actually goes down, which is an adverse effect of cash transfers, as this idea of non-labor income, or basically labor that's not coming out of your wage work, that provides an incentive for people to not engage in economic activities, which is not what we really want, because we do want households to find ways to get out of or graduate from poverty and graduate from these programs, right? So
Now, can I break in and ask you, what's the experience of other countries, or is it that each country has its own issues culturally, socially, and so on, and it's not easy to generalize?
Yeah. So it's definitely not easy to generalize the solutions and the problems as well. And we have a very unique set of problems with especially the economic crisis, the current the conditions of the economy. There are other countries that have more developed countries that have tried different sorts of social protection as well, where they have tried to tie employment or the probability of them working or employment as a condition for social protection or tax credits. If you work, you get some tax credits. So these are different ways to incentivize people to look for work, stay employed, and then still receive some benefits. So those have been employed, but these are a little bit difficult in our context because we do not have the institutional capacity or the personnel or the structures to have a system where we can tie employment or the conditions of employment to social protection, because we have a very large informal economy, very large informal sector. So different countries have different problems, and different those different problems need different solutions. But I think we definitely need to still look at these adverse effects that could rise out of a social protection program like we have here. And in my results, what I find is that these programs, so when I simulate these transfers, these payments to households, what I find is that food insecurity experience goes down significantly. So in especially for poor households or households severely affected, they almost experience around 9% decrease in their food insecurity experience, which is a large number. And then when it comes to indebtedness, the experience there is that it is not as effective in reducing the probability of being indebted, largely due to structural issues, because indebtedness is something that low-income households are usually take part to finance their day-to-day activities. So that's it is difficult to break out of that with cash transfers, but because you do need larger structural changes to empower people. And
right. Okay, so one of the questions I'm going to ask you after the break is the difference between Aswasuma and Samudri, and well, are we getting better at it? And what was actually wrong with Samudri? What were the weaknesses which were addressed with Aswasuma? But right now we need to take a short commercial break. I am in conversation with Dr. Pulasthi Amarasinghe, Research Fellow at the Institute of Policy Studies. Don't go away, we'll be right back. Welcome back to Face to Face. I am in conversation with Dr. Pulasthi Amarasinghe, who is a Research Fellow at the Institute of Policy Studies, and we are discussing the work he has done on the effects of the Aswasuma welfare program. Dr. Pulasthi, now the Aswasuma program came in after the economic debacle, when obviously the government and everybody felt the need that, well, there has to be an increased social safety net. And we had some of the going on at the time, but it was felt that that was insufficient. So Aswasuma was introduced. Can you tell us the major differences in the two, and from that, what was wrong with Samurdhi, and what been improved?
Yeah, so that's a very good question. I mean, this, and one of the key findings of my study is based on comparing, the eligibility and the criteria, to see if it's an improvement from Samurdhi. But if you go back to Samurdhi, you do see certain issues. 48% of the lowest 20% of households were covered by Samurdhi. That means 52% in the lowest 20% they weren't covered by it. And you have 12% of households in the richest 20% being covered by Samurdhi. So these are imbalances that you see in the way Samurdhi was operated. So there wasn't a consistent framework to have eligibility qualify households for the program. And
so that's a very scientific way of saying that the wrong people were on the list. Some people on the list were not people who should perhaps have been there.
I would call it would be definitely worth looking at who was in the list, who was not simply based on income, but there are other factors that go into vulnerabilities other than income. So you could be someone earning a decently high enough salary, but if you, let's say, you care for a lot of children, or if there are disabled individuals in your household, that adds a layer of vulnerability that could qualify you.
These are the 22 factors
22
that
factors
you explained earlier.
Yes, so that's why we do need to have a consistent framework to make sure that if someone from the 12% that was selected from the richest 20% households, if there's a reason based on the other 21 factors other than income to have them as qualified for Aswasuma, that should be the process. So that is where the transparency and the targeting based on an objective set of criteria comes in, or a predetermined consistent set of criteria. So this has been the biggest improvement, because the previous system, of course, there were concerns in the public about political involvement, or in terms of the complaints of like we said, the 12% of the richest households being in part of the program. Here what we have is under this system we have a digital social protection database where households are applying for the process to be part of the social registry, so anyone can apply, and they are basically their data on the 22 indicators are given to the system, and the system determines your eligibility based on district level criteria or cutoff marks. So this is this has basically laid the foundation for an objective system that is definitely an improvement over the Samurdhi in terms of having that sort of criteria. But that is not to say that there are areas that you can still improve. But in terms of Samurdhi, that is something that we see, and I think in my study I find that 53% of the households who received Samurdhi are eligible. So that means 47 of the households that received Samurdhi aren't eligible for Aswasuma based on the 22 criteria. And I did a comparison in my study to see across these 22 indicators if they are truly better off or more deprived, especially the households who were previously eligible for Samurdhi but not as eligible for Aswasuma, versus households who are now eligible for Aswasuma but not eligible, or were eligible for Samurdhi. And what I found was that Aswasuma does much better in capturing these vulnerabilities across these 22 indicators, because those who are actually eligible for Aswasuma show deprivations or more vulnerabilities in these 22 criteria than the households who are ineligible but were recipients of Samurdhi.
Interesting. So definitely a major step forward.
Yes.
And of course the complaints about the Samurdhi program had been there for many years. A lot of people who said that they should be on the list and they weren't, whereas their neighbor who was doing quite well is on the list, and why is that? And it's because he's working for some area politician or something. So there was quite a lot of, shall we say, unscientific political machinations were going on, and that was common knowledge. So hopefully much of that has been taken care of and addressed through these 22 factors.
So this is the main concern, to address that. Having a transparent system is one of the key concerns of this whole process, and the foundation's been laid to have this digitized system doing the work to determine who's eligible and who's not. So that means it doesn't involve administrators, or the person. Human inputs cannot go into determining who will be eligible and who will not be eligible. So that is definitely an improvement. But there are things to the same concerns are still happening in Aswasuma as well, where people are complaining about the neighbor or someone else being eligible and them not being eligible, or someone else receiving a higher payment than yourself, basically the other households. So there are comparisons happening, and there are cases that are being filed. But these things, there are grievances processes to handle these issues as well. But certain errors could happen. There are two major areas where there could be certain exclusion and inclusion errors. So basically, inclusion errors meaning people who shouldn't receive are receiving, and exclusion basically means people who should receive are not part of the system. Since this is a digitized system, exclusion errors are happening simply because not all households have applied for it. So I think the latest was around 3.3 million households have applied, and they have picked around, the system has picked around 1.9 or 1.8 million households eligible for the program. So you still have a large portion of Sri Lankan households that have not yet applied. So it is key to figure out, where they are. Are we systematically leaving certain, demographics out of it? So it could be the case, especially in rural areas where they may not have the facilities to make the trip to, do this application. They could be left out. And then when it comes to inclusion, there is a data verification process, but of course, that it takes time to to perfect any sort of system. So there could be errors in the way the officials or the local administrators verify data in terms of the 22 indicators, and any sort of misinformation could result in this these inclusion errors here.
Right. Now, I noticed in your research that you say that 2 in 5 food insecure families are not eligible for Aswasuma. Am I correct in
Yes.
that? 2 out of 5 food insecure families. So if you have 5 families which are food insecure, 2 of those don't qualify. Why is that?
So, so the way food insecurity was measured in the data set. So let me start by addressing the way I looked at food insecurity. So I think I discussed it a little bit earlier, because the food insecurity in the data set, or the data we have, looks at whether households face difficulty. So it's food security experience. So it's a difficulty in finding insufficient food, or reducing the number of meals. So these are somewhat subjective when you compare what a certain type of household will say versus another household will say regarding their food insecurity experience. So of course there needs to be improvement in having an objective measurement of food insecurity. But regardless of that, if households, let's say, reported that they reduced the number of meals, so that could be a more objective measure of across these different households. So let's assume that that we have an objective measure. So the reasons why we are not missing, or we are missing out on these food insecure households is, first, these are very sudden responses to poverty, or basically sudden responses to shocks. these are probably not going to be captured when you have indicators like agricultural machinery, or basically in the 2 and 2 indicators you have agricultural machinery ownership, ownership of paddy land over 2 acres. So these are very specific numbers that are not likely to capture households that are facing very transient shocks. Especially in non-agricultural urban household, urban poor households are likely to face these transient shocks, and this is unlikely to be captured through the current criteria. And then, of course, there are climate shocks, very temporary shocks that are not being discussed, or that are not being part of these 2 and 2 indicators. So looking at how climate has an impact, so droughts, these are factors that could affect these food insecurity experiences as well. And of course, there are selection bias in terms of gender being a big factor. So I think a recent report by the World Food Programme, what they found is that female-headed households experience higher rates of food insecurity than a regular household or male headed households. So in that sense, food insecurity there may not be captured if households do not apply. So if there's an imbalance in male-headed versus female-headed households in the application process, there could be underreporting of these households.
Right. Now, it struck me when you were talking about some of the criteria, such as agricultural machinery. Is the same weightage given to the 22 criteria across the island? Because I'm thinking that there are areas around Colombo where there would be people who would be below the poverty line, and then you would have people out there in Mullaitivu and Monaragala who are primarily based on agriculture, who would also possibly be below the poverty line. How do you sort of the 22 criteria, does it sort of match?
Yeah. So this has been addressed. So this is the weightage is done differently for each indicator based on the level of deprivation, as they call it, for each one. So basically, how many households are deprived of that particular indicator in that particular district, and if there are a lot of households deprived for a particular index, that's given a higher weightage than the other households, and then there's a weighted sum that's been taken to get the household value, and this is done at the district level. So let's say for Colombo versus Mullaitivu, the weight given to, let's say, agricultural machinery ownership is going to be completely different.
Right.
But this also brings up another issue in that there isn't some what you call a linear relationship or between poverty and certain types of indicators. For example, if you have an indicator of households not having 2 acres of paddy land, it's probably fair to compare a household with 1 acre of paddy land and 3 acres of paddy land. But having someone with 3 acres of paddy land and no paddy land, it doesn't necessarily mean that the other household the household without 3 acre any paddy land faces more economic hardships. It could be the case that they actually not engaged in farming agricultural activities and are probably better off in a more formal sector. So the way the comparisons are done for these certain types of certain type of indicators, we do have to revisit to see these. Are we addressing these non-linear sort of relationships between poverty, economic hardships, and deprivations in these certain indicators?
Right. And my final question, Dr. Pulasthi, since we're really almost out of time, is what are your key recommendations? Now, you've studied this program very thoroughly, and it's nice to know that scientists such as yourself, social scientists, are keeping tabs on everything that's going on, and it's not running to the whims and fancies of any politician of any color. But what are your recommendations at this point in time, which of course a year from now you might have different recommendations, but right now what do you recommend?
Yeah. So before I give the recommendation, I do have to say that there has been a good foundation being laid for an objective way to move forward when it comes to social protection. So, but there's of course room for improvement, looking ways to include these transient poverty individuals, as I said, people who are maybe facing shocks from maybe disasters or nutritional issues, to incorporate it into this program. So modifying the current 2 criteria to ensure that they are included. That would be one step forward, and I think that there is a review of the criteria happening right now as well. And of course, data is verification. Is that happening properly to ensure that the people who should receive are actually receiving these the benefits of these programs. And of course, we can expand the coverage into to cover not just based on these 22 criteria, but to have disaster exposures. I think that was part of the original Welfare Act back in 2002, to have households affected by disasters for them to receive sort of a benefit for at least 1 year. So following through these, of course it's a process, but having these other mechanisms to bring these different types of shocks that households face. If they are able to cover these transient shocks, I think that would be the most immediate step. But going forward, the other important thing is to make sure that we are monitoring the welfare effects and not just giving transfers, because we need to make sure that households are graduating out of poverty and the program, not that they are ending the period of transfers, but that they have actually benefited from the transfers to a point where they can graduate out of the program. So that of course requires an additional level of collection and monitoring, and so that's I think where we should go at the current moment.
So it's a good program, but it certainly can be improved, and
Yes.
It needs to be monitored and more improvements made. So I think that's where it is, and I'm sure perhaps in 6 months' time you can come back and tell us what's new, how it's going, and whether it's more effective or not.
Yes.
Right, and I'm afraid we are out of time. My thanks to Dr. Pulasthi Amarasinghe, Research Fellow at the Institute of Policy Studies, for being with us this evening. Thank you, Dr. Pulasthi. And thank you to you at home for watching. As always, don't go away because the news is coming up next. Have a great evening.